What's up, Uncle Mikey?
Welcome home. This is the coveted family album. Here is your grandmother here. This is when she actually lived in Jamaica, right?
Grandma in her nurse's uniform.
This is mom in her nurse's uniform. Everything concerning health, she always knew the answer to.
I remember how she was when I was growing up, and then I remember how she became because of dementia. And you know, even though my patient population was generally older people, having had like a family member who suffered from dementia, it motivated me to want to find out more about it. My name is Shamiel McFarlane. I'm a primary care physician, and I'm also a senior Atlantic Fellow for Equity in Brain Health. It's a year-long residential and interdisciplinary fellowship where you learn about Alzheimer's disease and dementia, and you are immersed at the clinic seeing real patients. And not only that, but you're learning about the policy aspects, the social side of medicine, not just the clinical side. My grandmother passed away from dementia. Dementia is actually an overarching term to describe diseases that affect your memory, just your ability to function on a daily basis. And it's difficult on the families to come to terms with that because it's a slow death. You see them dying little by little in front of you. I became aware of the issues faced by older adults in Jamaica by working in the public care system. The first time I actually went out into the community and went and did a home visit, it really was a wake-up call of just how unaware you are of what persons who don't have access and persons from a lower socioeconomic background, what it is that they're up against on a daily basis and the things that you take for granted. And I decided that what I was doing wasn't good enough. I could do more. Mr. McDonald, I'm coming around. I saw that there was a correlation between isolated persons with dementia, and increased hospitalization. Once they're hospitalized, they actually have poorer health outcomes and actually do worse, when it should be treated the same, just like your hypertension. Mrs. McDonald. Hi. Dr. Mac. All right.
You feel all right?
Yeah, man. How you been?
Well,
The memory never so good.
no, I always blame it on maybe the old age. Not at best.
Yeah.
Not at best.
All right. What about Mrs. McDonald?
Well,
Remember what she have again?
have a multiple amount of problem.
A typical home-based visit for a primary care physician in Jamaica, you do a history, you do a physical examination, you make an assessment on what you think their issues are, and if they need a prescription, you give it to them, and that's usually it. Primary care isn't assessing them for dementia. Your wife, when she has to go to the clinic, she can't really manage going to the clinic by herself.
All that physical, yeah.
So do you think that she would benefit if the clinic was able to come to her?
Yeah.
Yeah, greatly. Yeah. My research project is a feasibility study called the J-Hope Initiative. It is a home-based primary care program to socially isolated older adults who are cognitively impaired, to see if we can decrease their rates of acute hospitalization, if we can improve their quality of life, and if there is some improvement, how can we do this on a larger scale? In the Caribbean, doctors do home visits, but there is no nationally sanctioned home-based primary care program. How do I show my colleagues that these aren't separate issues to be tackled? Now that you are the medical officer of health for the St. Anne Health Department, do you think that we have the physician capacity to create a sort of home-based primary care program?
We know a lot of our elderly population has various chronic illnesses. Is it diabetes? Is it hypertension? I don't think there's any doubt that a program that really targets the elderly is something that is needed.
The unit would be a primary care physician, a community health aide, and a nurse that is exactly is more personal with the association of the CHA, who may know them face-to-face after having had many interactions with them in the past. So I think that there is a lot of room here for collaboration.
I do. And I think one of the things about Jamaica is that we love to be trendsetters. And we love to ensure that whatever we do is well done. So I congratulate you for that.
Thank you. I look forward to working with you.
Most studies about Alzheimer's disease and dementia have been done in developed countries, usually among a Caucasian population. One of the benefits of the Atlantic Fellowship for Equity in Brain Health is that we're now able to add to the conversation and our voices are being heard.
Hi guys, Augustine, I know that you started the Latin American Consortium.
We are working together with GBHA fellows and many other fellows to develop a consortium for Latin American and Caribbean research on dementia.
I think the whole part of the fellowship with
In a couple years, the information that you'll be able to get from this consortium will lead to a lot more policies and possibly breakthroughs with treatment. It's very easy to become lost in the disease process and the numbers. But if you have someone's own words saying, I want more from my primary care physician, that's really important.
All right. Anything else going on?
Very hard.
Yeah.
Hard, very hard to get food.
Yeah.
Me know nobody else. Come let me don't know nobody.
Yeah. I understand. I'm sorry.
At the end of all this, the patients are who we should be beholden to. How can we improve the healthcare system? And how can we work collectively and collaborate together for the person who at the end of the day matters most? And to me, that's the patient.